Hi, my name is Enedina Enriquez. Actually, it's Dr. Enriquez. I received my doctorate in social work about a year ago. I work as a clinical associate professor on a full-time basis with the UTRGV School of Social Work. The seriousness of this illness is that many individuals will not seek help or will not share their story of their emotional pain and suffering because of that fear of being labeled or judged. So warning signs of suicide, usually an individual, one, there is a change in their mood. Okay, they may have been happy-go-lucky and then all of a sudden they're very sad, they're withdrawn, they're isolating. They just don't have any energy or interest to participate or do anything. You may be seeing them failing in their grades at school. They're slowly, cutting ties with their friends. They may become argumentative and irritable, and you get to a point where you don't recognize your loved one anymore. Emotional pain is real, natural. It's a normal process. It's not that there's something wrong with the individual. If we look at our Hispanic culture or the Latino culture, we immediately assume that somebody must be crazy, están locos, if they try to seek, help outside of the family unit. Research has shown us that social isolation is usually one of the major factors that survivors or individuals with mental illness experience. And that's also a factor that leads them to a higher risk of dying by suicide. Suicide is the 10th leading cause of death worldwide. But it's also the second leading cause of death for individuals between the ages of 10 to 24. In 1999, it was the third leading cause of death for individuals between the ages of 15 to 30. That tells us that over the years, our numbers continue to rise, and now our younger generation is being impacted. You may not believe this, but a child as young as 4 years old understand what's suicide, and they also die by suicide. We need to take action now. We need to have these conversations now. We cannot follow the myth that someone must be crazy or están locos. We need to be able to learn how we can protect and support our loved ones when they are emotionally struggling. Thank you.